from time to time. Be affectionate. Be positive. Sometimes a simple touch goes a long way. As much as possible, provide a comfortable space for children to work in. You may want to be more lenient with the desired study location for teens. Encourage them to focus by minimizing distractions such as television, music, or telephone. As much as possible, encourage them to separate their eating spaces from their study spaces, minimizing the risk of damaging devices.
Protect yourself from the novel coronavirus. Wash your hands thoroughly and frequently for at least 20 seconds each time. Avoid shaking hands and touching your face with unclean hands. If you have to cough or sneeze, do so into your flexed elbow or a paper towel and then dispose of it. Keep a distance of 3 feet away from anyone with the cold or flu-like symptoms. Boost your immune system with vitamins, drink plenty of water, and get adequate rest. Visit your doctor, the nearest hospital, or health center if you or a family member becomes ill. A message from the Ministry of Health and the National Emergency Management Agency, NEMA. To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Is on.
Good afternoon and welcome to the National Emergency Operations Center COVID-19 daily briefing for the 5th of May 2020. I am Lesroy Williams. Thank you very much for joining us for today's briefing as we continue to provide you with information, the most up-to-date, relevant, and pertinent information with respect to how we are managing the COVID-19 pandemic here in St. Kitts and Nevis. I would like to recognize all of you who have joined us via television, ZIZ, via radio, ZIZ, Caribbean Broadcasting Network in the British Virgin Islands, and whether you have joined us via social media, YouTube and Facebook. Thank you very much for being with us. Today I recognize the Honorable Wendy Phipps, Minister of State with responsibility for health, Dr. Cameron Wilkinson, Medical Chief of Staff at the Joseph N. France General Hospital, and Chief Medical Officer, Dr. Hazel Laws. I also recognize Superintendent Cromwell Henry of the Royal St. Christopher and Nevis Police Force, and I recognize Mr. Abdius Samuel, Chair of the COVID-19 National Task Force. There are many people who have come on board in the fight against the COVID-19 pandemic. Many of them, corporate citizens and companies and individuals, have shown that they really care and that it matters to them that we can fight this virus together. Today, I have one such group or organization, the Reach for Recovery group. They're a breast cancer support group, and they want to donate to the Ministry of Health. They want to donate to the COVID-19 response here in St. Kitts and Nevis. I would invite Tricia King, representative of Reach for Recovery, to hand over a donation to the Ministry of Health to Dr. Cameron Wilkinson. Ms. King.
Good afternoon, everyone, and thank you. The executive and members of the Reach for Recovery Breast Cancer Support Group are honored to place on record our appreciation for the work of the medical team headed by yourself and all on the frontline workers involved in the fight with the new COVID-19 virus. We are aware that everyone has a positive role to play. As a cancer support group, we are particularly concerned with the support and protection of cancer patients, especially those undergoing treatment at the local oncology unit at the Joseph and France General Hospital. We recognize that they fall in the more vulnerable and compromised subset of the population. As the world battles this COVID-19 pandemic, we recognize the need for our Pink Care initiative. It has to extend upon its normal boundaries. It's against this backdrop that we wish to make a donation of $2,000 to your team for the procurement of protective items for persons who visit the oncology unit for treatment. In addition, we recently launched a notice on our Reach for Recovery Breast Cancer Support Group Facebook page expressing our commitment to assist breast cancer patients who need our help. So we are also asking for further help in this regard and thanking everyone who has helped thus far.
Ms. King, on behalf of the Ministry of Health and all those who access care at the oncology unit at the Joseph and France Hospital, I want to say how deeply touched I am. I know that your organization has been involved in the care of persons with cancer, persons who've been fighting for their lives, and therefore you understand the fight that we're in, because this disease is not just in one group, but it's affecting the entire population. And I'm happy that you've chosen to come on board. I know how dear these funds are to you in your fight against breast cancer, but the mere fact that you found it within your organization's heart to come on board and to give us a check of $2,000 to go a long way in helping to protect our staff and the persons who access care for cancer at the hospital, it is indeed touching. And I want to say a big thank you to you and your organization. And I hope that our other NGOs take note and they follow in your footsteps, because we have emphasized over and over again that this is an all-of-society approach. And I'm very happy that every week we see persons coming on board to help us with this fight. So one day, hopefully soon, we can declare our nation COVID-free. I thank you.
Thank you, very much Tricia on behalf of the Reach for Recovery Foundation. Thank you very much for your donation. I would now invite Superintendent Cromwell Henry, Divisional Commander for District A in St. Kitts, to give us his report. Superintendent.
Thank you, Mr. Williams. A pleasant good afternoon to all listening to this broadcast. For the past 24 hours, police have made 4 arrests of persons violating the curfew. To date, number of arrests for the period of the emergency is 113. Motorists with vehicles ending with 3 and 4 are reminded that you have until Friday the 8th of May to have your vehicle licenses renewed. To avoid the lines at the Inland Revenue Department, you are encouraged to use the online vehicle and driver's license renewal option at www.sknird.com. Please note that the concession to renew your vehicle license without the inspection certificate has ended. You are therefore required to upload your vehicle inspection certificate in the appropriate field on the website. Your transaction will be declined if this certificate is not uploaded. Remember to keep your receipt with you to present to the police until you have received the license from the Inland Revenue Department. You will be notified when your license is ready for pickup. Drivers are also reminded to check your driver's license to ensure that it is still valid. Limited operation day ends at 7 p.m. this evening. Businesses are reminded to close at a reasonable time to allow patrons and staff to get home before the curfew begins at 7:01 p.m. We are concerned about the rush that takes place on our roads just before the curfew begins. This increases the risk of accidents, which may result in injuries, damage to property, or even death. The curfew ends at 5:59 a.m. tomorrow, and the next limited operation day begins at 6 a.m. Persons found on the street before the curfew ends run the risk of being arrested. Wear your mask in public and stay safe. Thank you.
Thank you, Superintendent. I now invite our Chief Medical Officer, Dr. Hazel Laws, to give us the COVID-19 situation report for St. Kitts and Nevis. Dr. Laws.
Thank you, Mr. Williams, and good afternoon to everyone. As of today, May 5th, 2020, at 3 p.m., the World Health Organization reports 3,525,116 confirmed cases of coronavirus disease globally, with 243,540 deaths. To date, 318 persons have been sampled and tested, with 15 confirmed positive, 303 confirmed negative, and 0 results pending. This afternoon, I would like to confirm that we have 12 confirmed cases who have recovered. I repeat, 12 confirmed cases have recovered. To date, we have 0 deaths. Currently, 55 persons are quarantined in a government facility, while 5 persons are quarantined at home. 3 persons remain in isolation, while 744 persons have been released from quarantine. On March 11, 2020, the World Health Organization characterized the coronavirus disease outbreak as a pandemic. The Ministry of Health activated the Health Emergency Operations Center on Tuesday, March 24, 2020, in response to this declaration. The Health Emergency Operating Center team consists of the following persons. The Public Relations Officer is Dr. Marissa Carty, who is also an NCD coordinator. The Operations Manager of the HEOC is Mr. Sylvester Bell, our health planner. The planning managers include Dr. Keisha Liddy, who is our Director of Community-Based Health Services. She is ably assisted by Sister Sandra Lestrade Keynes, who is the Deputy Director of Institutional Nursing Services. She is also assisted by Nurse Davida Irish, who is our Coordinator of Community Nursing Services, along with Nurse Sharice Wallace, who is the Infection Prevention and Control Officer at the JNF General Hospital. In Nevis, she is assisted by Dr. Judy Nisbet, the Medical Officer of Health, who is assisted by Dr. Retna Walwyn Brown, who is the Deputy Medical Officer of Health. Mr. Alexander Riley, the Chief Environmental Health Officer. The Logistics Manager is Ms. Verna Brown, who is the Admin Officer of Community-Based Health Services. Data management is conducted by Dr. Rafael Rosales, our national epidemiologist, and he is assisted by Ms. Kayla Farrell, our statistician. The finance team sub-team consists of Ms. Kishma Cranston, who is the Admin Finance Officer in the Federal Office of the Ministry of Health, and is also assisted by Ms. Gail Cranston, Operations Manager at JNF General Hospital. I would like to acknowledge the valuable support of the Permanent Secretary of the Ministry of Health, Dr. Dolores Stapleton Harris. The Health Emergency Operating Center team meets daily. We meet daily, 7 days per week. Today, I would like to use this forum and opportunity to thank each member for their individual and significant contribution to the fight against the coronavirus. We have been successful in containing the first wave of the COVID-19 cases. On the ground, we continue active surveillance for coronavirus disease cases, and we continue aggressive tracing of contacts of cases. This is our reasonable service. It was Desmond Tutu who once said, "Do your little bit of good where you are. It's those little bits of good put together that overwhelm the world." End of quote. I thank you.
Thank you very much, Dr. Laws, for sharing that report. It's always good news to hear when people are recovered. And we thank God that of the 15 cases, confirmed cases, that there are now 12 recovered cases and that there are only 3 active cases and no deaths. I now invite Mr. Abdias Samuel, Chair of the COVID-19 National Task Force, to address us. Mr. Samuel.
A pleasant good afternoon to all, and thank you, Mr. Williams, for for coming back to us and being here with us again. Ms. Southwell would have done a tremendous and wonderful job in your absence. Again, greeting to those who are logged on via the internet, listening via radio, and watching via television. Today, Tuesday, 5th of May, and happy Cinco de Mayo to our Latino friends, particularly Mexico and elsewhere. Today, the COVID-19 Compliance Task Force would have begun the enforcement operations, and in doing so, they would have visited a total of 56 business places. Out of the 56 business places, these were salons, barbershops, bakeries, clothing stores, doctor offices, supermarkets, mini-marts, government departments, pharmacies, furniture traders, hardware stores, food vendors, rum bars, broker and agents, restaurants, village shops, car dealerships, banks, and insurance offices, amongst many others. I am informed by the head of this task force, Ms. Marceline Hughes, that 2 businesses were asked to cease operations in accordance with the statutory rules and orders number 15 of 2020, as they were in violation of section 10 and section 14, which deals with restriction on social activities and suspension of all retail liquor licenses. As a matter of fact, the Compliance Task Force stated that they were actually educated and the business places acted on their own to cease operation rather than being enforced. The Compliance Task Force continued its work, visiting 14 new business places that were not previously in operations. So business places who will continually to open, put the protocols in place, put the different measures in place to be compliant with the statutory rules and orders 15 of 2020. They opened up this week. That's a total of 14, and these business places were visited by the task force. The task force also stated that they wish to applaud the work that has been done by the Department of the Physical Planning Unit, who were in full compliance when they were visited today. They stated that they can be a model that individuals can use as to what is required to be compliant, let me say fully compliant with the regulations. One key aspect that was brought to my attention, which most will think that would be non-compliant, was some of the barbershops that are owned by Latinos. They were fully surprised to see that most of these barbershops were in full compliance with the regulations. This morning, I've had the privilege to have a citizen of St. Kitts and Nevis enter my office and give a donation of $600. He is an employee of the cable, and he said that he would like his $600 contribution, which he made in cash, go to the vulnerable. And he gave me a story of back in the days when his mother had to mix flour, water, and a little bit of salt. But before she mixed the flour, she would have had to get the weeble out the flour. And sometimes after the end product of the flour, he will hear the little crunches, which means one or two weeble would have gotten in between. And bearing in mind that God has brought him this far, he said he saw it as his civic duty to be able to give this donation. So to the cable guy, thank you so much. I also want to acknowledge Joel and Stephanie Francis, who extended a letter of encouragement and support to the task force. Thank you again. Everything that is done, whether it be a letter, whether it be a donation, is welcome. I want to take this opportunity to clear the air on something. Yesterday in my deliberations, I made mention of the environmental health officers. This morning, I was contacted by several persons wanting clarity on the matter. I said that we don't see them, not that they're not visible, not that they're not working, meaning that, you know, most persons won't see the work that they are doing, and they are doing a lot of the hard work, the groundwork, moving and dealing and interacting with these individuals who may be potential COVID-19 cases. And I simply intended to highlight them, thank them, and acknowledge the hard work and the contribution they make to the fight against COVID-19. So I do hope that there is clarity and there is understanding. Tomorrow, the members of the task force will be meeting with the Christian Council and the Evangelical Association in an effort for us to start to brainstorm as to how we can use various models that are being implemented around the world to look at reopening churches. I just want to basically remind you, the general public, that we are not yet out of this pandemic. Not because we are looking to revive the economy, not because we are doing our best to see how we could bring back a level of normalcy within the new norm. That means that we are in the all clear. Please continue to bear in mind that we are still facing an outbreak. There's the potential for a second wave. We still have to be mindful that we have active cases that are still isolated, but we have more tests pending. I will continue to ask you to pray as a God-fearing nation that we continue flattening this curve, but we have to do so responsibly. There's a lot of question about, well, you know, if we are doing so well, what about opening the borders? That is a very, very lengthy discussion that's going to be very slow. So again, I want to thank everybody for their cooperation thus far. I want us to continue doing our best in fighting this curve. So to all who will continue to support and watch the program every day, thank you so much, and God bless you.
Thank you, Mr. Samuel, for your report. That brings us to the question and answer segment. The first question goes to the police. At yesterday's briefing, when asked about the video showing Dr. Douglas and some supporters out on the streets, Superintendent Henry said that the police will investigate the incident to see if any of the regulations were breached, given that they were given permission to hold certain activities. Could the superintendent please indicate what exactly did the Labour Party request and what activities were permitted by the Commissioner? Superintendent.
As I mentioned yesterday, the High Command will be reviewing the incidents of yesterday, and at an appropriate time, if it is found necessary, a statement will be made upon whatever the conclusions of that review are. Thank you.
This question is for Dr. Wilkinson. Can you explain more about the headaches that are associated with the COVID-19?
I'm not quite sure I understand the question. Persons who have COVID-19, it's a flu-like illness, and so they may have headaches, they may have fever, joint pains. Some persons may even have nausea, vomiting, diarrhea. But there is nothing in particular that I can tell you right now as it relates to the headaches.
This one is, thank you, Dr. Wilkinson. This one is for the Chief Medical Officer. Do we have access to drugs for possible treatment of COVID-19? In the 1,063 patient trial, the time it took for half the patients to recover was 11 days with remdesivir versus 15 days for patients in the placebo group. As we gradually relax our curfew, please let our young folks know, as of last Friday, I saw on CNN where a black female, 22 years old, died from coronavirus, leaving behind a 2-year-old. Dr. Laws.
We want to thank you for your question and your statement. Now, remdesivir is a broad spectrum antiviral medication. It's presently undergoing investigation in 2 or 3 clinical trials in the United States of America. And because of the outcome so far, the FDA recently approved emergency use of the drug for the treatment of coronavirus disease because it seems to accelerate the time to recovery from 15 days to 11 days. Now, it's still a bit early for us to determine the full effect or all the effects of this new drug in terms of treating those who are seriously ill with coronavirus disease. Because some medics say there isn't much of a difference between 11 days and 15 days. And just a few weeks ago, the outcomes from this same drug the outcomes were not as favorable. And so in the Ministry of Health, we are monitoring the results from these randomized controlled trials closely in order for us to determine the net benefit to persons who are ill with coronavirus disease. Now, in terms of coronavirus disease and its impact on those who are young, I just want to underscore that this new virus, is no respecter of persons and age. It impacts little children, young adults, middle age, and old. And you would remember my providing you details, even from our local data, the mean age of persons impacted here in the Federation is 32 years. Thank you.
Thank you, Dr. Laws. This question is from Alicia Daniel Blake at Sugar City 90.3 FM. One News, a publication of St. Vincent, has reported that the Royal Caribbean Vision will sail from Miami on May 15th and will sail to St. Kitts, Dominica, St. Lucia, Grenada, Trinidad, and St. Vincent and the Grenadines, where she will end her voyage on June 7th, and return sailors or employees that worked on their cruise ships that are citizens of our islands. Is national security aware of this? And do we indeed have such nationals of the Federation who were working on the cruise ship? If so, what is the procedure once they arrive? Attorney General.
Good afternoon to everyone. The borders of St. Kitts and Nevis remain closed, and until there is an announcement that the borders, the regulations closing the borders have been rescinded, there would not be any visits by any cruise lines at this time. We wait such further advice. Thank you.
Thank you very much, Attorney General. This question is from SKN Newsline. With respect to persons arrested for not wearing masks, were these persons essential workers, as some sources have indicated? Superintendent.
None of the persons who were arrested for not wearing masks were essential workers, at least not that I'm aware of.
This is for the doctors in the room. Are the 8 persons in isolation located at their homes or at a government facility?
Now, I think it was about 2 days ago, I shared the journey of one of our index cases where when the information just regarding the age and sex was given out, this person was hunted down and the trauma that they went through. And because of that, we have a responsibility to protect the confidentiality of the persons who are being tested positive. And I don't see, even from a public health perspective, why that information as to where these persons are quarantined or isolated is important. Because we have said before, you have to assume that everyone might have the virus, and the way you protect yourself, if you assume that everyone has the virus, is by staying 6 feet from that person and wearing a mask. And so just by you identifying the few persons who were diagnosed as being positive, that's not going to help you in controlling the disease. And not only that, it's not 8 persons who are isolated now, it is 3. And hopefully very soon that number will be down to 0, and so the question will be immaterial. I thank you.
Thank you, Dr. Wilkinson. This person is seeking clarification as to whether all persons coming into the Federation after the borders are opened will be quarantined in a government facility. Attorney General.
Thank you. Again, I repeat, the borders of St. Kitts and Nevis are closed, and until we have advice from the medical fraternity or experts or health professionals, and Cabinet accepts that advice, that will be the case. As to what happens after that, again, we would have to accept advice from our health professionals. But as we open up gradually, internally, we expect to get back to a certain level of normalcy. At this point in time, we are being very cautious to protect the health of all our citizens, to prevent any transmission of the dreaded COVID disease. Thank you.
I would invite Superintendent Henry to address this matter with respect to the wearing of masks, and there are some people with concerns that they are seeing some law enforcement officers who are not wearing the mask. Superintendent.
All our officers were issued with masks. Masks are available for all our officers. They have been directed to wear their masks when they are out in public. And so I cannot respond to that, where officers are not wearing masks. Those that I've seen them wearing their masks. And so if members of the public see an officer wearing a mask, call the station or speak to the officer and advise him that he should wear his mask. But all our officers have been directed to wear their masks, and masks are available for all officers.
Thank you, thank you, Superintendent Henry, for that response. I suppose everyone has a personal responsibility to ensure their own safety, but at the very same time, that personal responsibility also shows that we have a collective responsibility to ensure that others are safe too, and that we are safe. That brings us to the end of our question and answer segment. I want to thank all the persons who submitted their questions, and I do hope that your questions were answered in a satisfactory manner. Before we end today's press briefing, there's a little story that I found to be very impactful to share with our audience. It was a world of waste and wonder, of poverty and plenty, back before Hindsight 2020. You see, the people came up with companies to trade all across lands, but they swelled than we ever could have planned. We'd always had our wants, but now it got so quick. You could have dreamed of in a day, and with a click. We noticed families had stopped talking. That's not to say they never spoke, but the meaning must have melted, and the work of life balance broke. And the children's eyes were squarer, and the toddlers had a phone. They filtered out their imperfections. Amidst the noise, they felt alone. And every day the skies got thicker, till you could see the stars. So we flew in planes to find them, while down below we filled our cars. We'd drive around all day in circles. We'd forgotten how to run. We swapped the grass for tarmac, shrunk the parks till there were none. We filled the sea with plastic, because our waste was never capped, until each day when you went fishing, you'll pull them out already wrapped. And while we drank and smoked and gambled, and leaders taught us why, it's best to not upset the lobbies, more convenient to die. But then in 2020, a new virus came our way. The governments reacted and told us all to hide away. But while we were all hidden amidst the fear, and all the while, the people dusted off their instincts. They remembered how to smile. They started clapping and say thank you, and calling up their moms. And while the car keys gathered dust, they looked to have their runs. And with the skies less full of voyagers, the earth began to breed, and the beaches bore new wildlife that scuttled into the seas. Some people started dancing, some were singing, some were baking. We'd grown so used to bad news, but some good news was in the making. And so when we found the cure and were allowed to go outside, we all preferred the world we found than the one we'd left behind. Old habits became extinct, and they made way for the new. and every simple act of kindness was now given its due. But why did it take a virus to bring the people back together? Well, sometimes you've got to get sick before you start to feel better. I thought that was a very impactful piece of literature. Sometimes we've got to get sick before we get better. What is this teaching us? This pandemic teaching us about how we were, where we are now, and where we are going. Thank you very much to the representative of Reach for Recovery Foundation, the Breast Cancer Support Group, Tricia King, for her donation to the Ministry of Health, Superintendent Cromwell Henry, Divisional Commander of District A, Chief Medical Officer Dr. Hazel Laws, Abdias Samuel, Chair of the COVID-19 National Task Force, our Attorney General, the Honorable Vincent Byron, the Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson. I also want to thank Ms. Vesta Southwell, who filled in for me yesterday and did a tremendous job. Thank you, Vesta. We also thank all who joined us today for today's briefing, joined us on television and radio and on social media. We particularly thank ZIZ, who continue to be here, and Open Interactive, and Caribbean Broadcasting Network in Tortola, who carries this briefing live. We thank Mrs. Christmas Jacob for continually assisting us with sign language. Tomorrow we'll be back for another daily briefing. Until then, take care and take care of yourself.
And at the same time, we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning, standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart, and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the pace gonna lock down. Y'all make it nice, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Is on.